Welcome, everyone. Tonight we'll be addressing data gaps. This is the Prince George's County Healthcare Action Coalition, and we are so excited to have you all here in the room with us this evening. I'm going to go next to share what the agenda will include. Oh, before I do that, let me tell you who I am. Many of you may not know me. I always forget to introduce myself. My name is Dr. Stacy Little. I am the a co-chair. I'm a community member here in Prince George's County and have been a member of the coalition now for, I don't know, maybe 4 or perhaps 5 years, and have been involved in health literacy, health equity, health and all policy work that we've done to elevate those issues to council and now serving as co-chair. I am a program manager within the federal government in the Administration for Children and Families. And so this is my connection to public health that I can never seem to let go. I need to have that in my life. Um, so anyway, let's move on. So we're going to have updates from Dr. Levy about what's going on in the health department. I know many of you are probably looking forward to hearing about that. We also will talk about the coalition rebranding and the state health assessment priorities. And then lastly, we'll get into a discussion about the community health assessment data needs, which it takes a village, everyone. So have a positive attitude about that and how you can assist. And then last, we will, of course, adjourn the meeting. But this is a meeting that we're hoping is a dialogue with input from our coalition members and not just Dr. Levy and team talking to you, but you and really engaging. So without further ado, let me introduce Dr. Levy. Dr. Matthew Levy. He's our health officer for Prince George's County, and he will also be joined by one of our own, Stephanie Slowly Little, and it's a pleasure to have her this evening to share the updates with Dr. Levy. And she's a friend. She's a friend of the coalition and a friend of mine. And it's good to see you tonight, Stephanie. So go ahead, Dr. Levy, take it away. I'm going to be
Dr.
quiet.
Little, thank you. And it's a pleasure to see you tonight as well. And I noticed I'm wearing purple, which is the color of recovery, and it is Recovery Month. So that was appropriate, although I didn't wear that sweater tonight. Um, and I wanted to introduce Stephanie Slowly Little, who is our new Chief of Health Policy and Innovation. She took on the role that was previously occupied by Caitlin Murphy, who went to become one of our ADs. And we are thrilled that Stephanie is with us. She comes by way of Maryland Department of Health, and particularly the Behavioral Health Division, Behavioral Health Administration, where she was head of program planning. Before that, she was at the Office of Minority, Deputy Director at the Office of Minority Health, and she's done so much other stuff. And she is a social worker who has been working actively, has had active practice for about 10 years. And we are just thrilled she's here. She brings a wealth of knowledge and insight, critical thinking, and we couldn't be happier. So, Stephanie, you are welcome to say something, or if I have said what you wanted to
You
say.
you said you said you said everything, Dr. Levy, but I am very excited to be a part or be back a part of the coalition. I definitely am not new to it. Dr. Little, is always good to see you. Although we are now sisters by a different thing, because since we've seen each other, I have gotten married and now I'm a little as well. So that must be a good thing. But happy to be here, happy to be a part, and more importantly, happy to really be rooted and grounded in the work that we're going to be doing here in Prince George's County. I'm very excited to be a part of the group, very excited to be help and assistance to the work that we're doing, and look forward to just doing much, much, much really great and transformative work here in the county. So thank you, Dr. Levy, for bringing me on, and I'm happy to be a part of it. And Dr. Little, it's always good to see you.
So, next slide. So as we've talked about many times, our vision is that all Prince Georgians are healthiest at every age and every stage. This is the health department's new vision statement from last September. And our mission is to lead, engage, and empower our community to work collaboratively towards disease prevention, health equity, and total well-being. So this coalition really is one of the things we love to do, because it is in our mission, and it is about collaborating in total well-being and health equity and disease prevention. And this is what the coalition is doing. So we really appreciate all your time and all your expertise in helping to move the broader mission forward, which is also the mission of the health department. Next slide. I'm not going to read all the value statements, but it's really equity, diversity, inclusion, respect, teamwork, accountability, and innovation and excellence. These are the things that we have decided that we value, and we as a health department are starting to try to live those values and to really create a high performance organization. And I'll go into that in a second. Next slide. So I think this is a little bit out of place. We go to the next slide for a second. Okay, go. So we'll stay on this one for a minute. So the health department is, as I mentioned, is starting our strategic planning process. Jake Riley is on. He's the head of our Office of Assessment and Planning. You've known him for many years now, and he is helping to lead this list. And Stephanie's going to be involved, and Amber and Taylor and Deborah, and I can't see everybody that's on the call, but everybody's going to be involved. It's really going to be a very iterative process, and you are going to be involved. Whether you don't have to be, but we'd ask you to be. And we're going to be doing a community survey about the needs of the community and about the health department as well, and what we do well, what we don't do well, where you'd like to see us head, really to get your input. That should be coming out in the next 2 months, as well as we're going to be creating some focus groups, and which will be much more intense and will be more time. But we again ask you, if you are interested, to participate, because we will use that information to drive the priorities of the strategic plan, which will then drive the goals and objectives, which should line up nicely with the chip. And what we all, as we move through MAP 2.0, we will also be engaging. And so these things will be sort of two sides of the same coin, so that we move together, not the same, but together, to solve large county problems and challenges that we have, that we come to as an organization. So they shouldn't be, we shouldn't be going left and you shouldn't be going right, so to speak. The coalition shouldn't be like in different directions, because we want to have sort of an idea of where we want to be in 6 years, and working with you to sort of identify what that looks like. We've been talking about this, now we're starting to actually do it. So, and I look forward to working with you and getting feedback from you to help drive us forward and change the health department. Next slide. So the meeting objectives today are to prioritize the coalition name preferences. So we did that. And they should be reflective on the state and the county health priorities. And then we're going to explore the data sources ultimately in the community health assessment. And that's part of the MAP 2.0 process. We're trying to figure out now how we can do parts of the CHA and parts of the strategic plan around data collection and assessment together, so that we can maximize our resources and minimize the ask of you, because we know you're all very busy and you have actually day jobs that aren't in the health department. So we want to make sure that we are respectful of that. Next slide. So, Taylor, do you want to do this, or do you want me to do this?
Absolutely, Dr. Levy, I can step in. So
Okay.
As Dr. Little and Dr. Levy mentioned, we're going through some coalition rebranding. In our last meeting, if you were able to join us in our June quarterly meeting, we had everyone think of words that remind them of the coalition. And you can see the word cloud that you all put together. These are all words that come together when you think of the coalition and that mission and vision of what the coalition is trying to do through these thoughtful partnerships. So what we're going to do tonight, we're going to use all of the thoughts that you all gave us back in June. We have created a list of about 12 names. We're going to rename the coalition tonight. We have 12 names that we want you to all vote on. We're going to ask you all to pick your top 3 name choices. And you may be asking, why are we renaming the coalition? Why are we going through this rebranding process? We recognize in saying that we are the Prince George's Healthcare Action Coalition that we want to make sure that all of our partners feel welcome, that they feel that they are part of this mission, and that healthcare isn't limiting our partners, and that even if you're not a part of healthcare as a whole, that you might fit into our puzzle elsewhere in the coalition. You may represent your organization, you may represent a different sector of health. And this is a very multi-sector approach that we take to the coalition, and we value all of our partnerships that we have. And we want to make sure that the name that we are operating under represents all of our partners and is something that all of our partners feel proud to represent. So again, here are 12 options that we have put together from all of the words that you all described to of the coalition. And we're hoping that you all feel confident in these name choices, and that if you would vote for your top 3, we'll then be able to open it up to the rest of the coalition for those who are not able to join us tonight, and we'll be able to vote on our top pick. So before I do that, does anyone have any questions about the rebranding, about the name change, or any feedback?
Taylor, can you go back for a second to the
Yes.
list? So I just, maybe for those who can't see the slides, maybe we should read them off so they can hear them. Prince George's, I'll go ahead. Prince George's County Healthy Communities Coalition, PGHCC. Prince George's County Community Health Coalition, PGCHC. Prince George's County Health Action Coalition, PGHAC, same as we have now. Prince George's County Health Collaborative, PGHC. Prince George's County Health Partnership, PGHP. Prince George's County Cares Health Coalition, PGCHC. Prince George's County Allies for Health, PGAH. Prince George's County Community Partnership, PGCP. Prince George's County Community Collective, PGCC. And Prince George's County Health and Wellness Coalition, PGHWC. Prince George's County Allied Collective, PAC. And Prince George's County Allies for Community, PAC. So thank you. That was I didn't practice that. That was spontaneous. So those are the choices. And then go ahead, Taylor. You can go to the next slide.
Absolutely. So what we're going to ask folks to do, Ray, if you could put that link in the chat, what we're going to ask you to do to have to be able to live vote tonight. If you have a smartphone next to you, near you, if you can scan the QR code like you're taking a picture, or if you can go to slido.com and you're going to enter the 7-digit code in. It's going to be 6101417. So you can either join on a computer or you can join on your mobile device.
Taylor is not pulling up. It's not showing me. Oh, there. It's not show. Oh, there it is. Okay.
And so again, if you could please acknowledge your top three name choices for the coalition. And feel free to come off of mute if anyone is having any issues accessing the poll.
I just wanted to point out that the last two names, the PACs with the acronym PAC can be pronounced PAC, like PAC, like a coalition PAC. Anyhow, that was all for just for clarification.
Thank you, Ray. Ooh, so we are at a four-way tie for number 2.
Taylor, saying that 14 people have voted. There's 21 people on the call.
So for our other 7 who haven't voted, is anyone having any trouble accessing the Slido? And Denise, I see your comment in the chat. Were you able to go to slido.com, or are you trying it on your phone?
I tried to click on the link inside the chat and it says there's no available Slido vote taking place at the moment, but it's okay. I am just joining and can add mine to the chat if that's easier.
Okay, and I think that that number in the chat is off by a digit. It should be 6101417.
Ah, that's it. Just went out. Now you'll know my vote. No problem. All right, 6101417. Perfect. That's probably it. Yep, that was it. Thanks, Taylor.
Thank you, Denise. Great, and then look at that, 21 out of 21 for all of our EPI folks. Is this your first time seeing 100% response rate? All right. Well, thank you, everyone. So I think we have our top three here. So we have the Prince George's Community Health Coalition, the Prince George's Healthy Communities Coalition, and then the Prince George's Health Action Coalition. So our next steps will be, we are going to open this up to the rest of the coalition to reach the folks who weren't able to join us this evening. We will take those top three choices that you have all voted on, and we will ask everyone to pick their top name choice. The survey will be open through Monday, September 30th. So when you see that come out in the newsletter, or if you see it in a work group meeting, please cast your vote. And hopefully by the 1st of October, we will have a new coalition name. So thank you so very much for voting tonight. And Dr. Levy, do you have any additional words for our rebranding?
No, I think the top choices all represent a broader reach of folks, and look, the group is decided. The votes have been cast, so we'll be using this, and then we'll get the final tally. This is great.
All
Dr.
right.
Little, any thoughts?
No, I'm happy with the choices as well. I thought actually they were all pretty good, but just a couple rows to the top for me.
Well, thank you again, everyone, for giving all of your opinions back in June, for creating that word cloud, and thank you for giving these name options. These are truly representative. They are a mirror to everything that you guys had to say about the coalition. So we're really glad that this is representative of the group, and we are excited to see which name will prevail.
Yeah. Hey, Taylor.
Yes.
Yeah, this is Greg Taylor again. I put a comment in the text about the name convention and the fact that we need to keep the Prince George's County Health Department visible because there are so many similarities of initiatives within the community. And so no one will know whether or not this is really the health department or a similar nonprofit initiative. So I like the idea of the Prince George's Health Department Coalition or whatever, but keeping the visibility on the health department, which is the nucleus for this entire initiative. That's my comments.
Thank you, sir. Yes, we make sure that when we are sending out materials that we're always reminding folks of the health department and going through the mission and vision and those value statements at the beginning of the meeting. That is a reminder of our alignment with the health department, with their partnership, and again, representing all of our partners in the community. So thank you for that feedback. We will continue to implement it. Dr. Levy,
And I
anything you
just
want
want
to
to add, Taylor, that we just, this is sort of a tangential a little bit, but we just actually rebranded the health department's logo. I don't know if we saw it at the beginning.
We did not. Does anyone have it to put it in the chat by any chance?
We did sort of a similar internal process, which is we created 4 different options and we asked our department to kind of weigh in on all the different types, and they overwhelmingly picked the one that we now came to. So we're trying to be more inclusive in our decision making, more along the lines of being a health a high performance organization. So just this is, do we have a slide on HPO later, or is that this is it? So just to go just go off script for 2 seconds. This in August, we wanted to embrace the move to be a high performance organization, which is a way of sort of saying we want to create a more inclusive health department where people are leaders at every level, and that we work together to solve problems and bring subject matter experts, regardless of whether they're at the top of the leadership or they're on the front line. We want them to be part of the conversation and part of the planning and the strategic planning of what we do, and that we are not as siloed as we want to be less siloed and more cross functional. So we sent all of our leadership, all 104 of them, through a 3-day intensive high performance training program so that we could be all speaking the same language, and then moving that through our organization to create a more trusting environment, as well as uh, fostering innovation and becoming more a higher performance organization, so that we can serve the community and you more efficiently and effectively. So we are on this journey, and it's very exciting. And people were so excited and charged up in the trainings, and people were bringing ideas back, and it really was a wonderful way for us to start truly living our values, not just talking about them. So all this is rolling together in how we approach our collaboration with the community and with each other. That was all I got.
Thank you, Dr. Levy. Great. Well, thank you again very much for engaging in that, and continue to engage as you see that poll come out in the newsletter and through our work group meetings. And again, that voting will be open through Monday, September 30th. All right, and next it is my pleasure to introduce Deborah Collier from the Office of Assessment and Planning with the Prince George's County Health Department. She is going to be talking a little bit more about the mobilizing for action through planning and partnerships, the MAP 2.0 process that Dr. Levy named earlier. This is the process that will inform the 2025 Prince George's County Community Health Assessment.
Good afternoon, everyone. As Taylor mentioned, we just wanted to just kind of get a little bit of background before we kind of move into some of the assessments. But the MAP 2.0 framework is a framework that will essentially inform how we will continue to move forward with our community health assessment. But it also is a framework that emphasizes the importance of community engagement and an emphasis on health equity as well. So our process will include 3 phases. Phase 1, which is building the community health improvement foundation, which provides an opportunity for creating a common mission and vision, and develop a common understanding of how mobilizing for action through planning and partnership, or the MAP is the acronym for MAP, can be used toward working toward health equity. Phase 2, which tells the story of the community, so essentially the community health assessment, including qualitative and quantitative data with emphasis on health equities. And then phase 3, which is continuously improve the community, which is a phase that primarily is related to development of the CHIP and CHIP goals. This phase is used for continuous quality improvement. So we'll start to look at small scale improvements, and then using that to test on strategies for health equity efforts. So the major advantage to using the MAP framework is the emphasis on community partnership and engagement, as well as just kind of addressing health inequities from the systemic factors related to health equity. Okay, thank you, Taylor. That's a slide. So the slide here that you're all looking at is actually going to look a little bit deeper into phase 2, which is telling the story of the community. So phase 2 involves 3 different assessments. One being the community partner assessment, the next being the community status assessment, and then the community context assessment. The community partner assessment is an assessment that allows the community partners to look at their own individual systems, processes, and capacity, as well as look at their collective capacity to address health equity. So the capacity between the community partners and the health department, as well as any other hospital partners that we may have. And so it just kind of allows us to kind of take a deeper look at understanding how we work better together to look at different resources, policies, data capacity, workforce and leadership, health equity capacity, and then again, community engagement. The next one is the community status assessment, which is essentially the quantitative assessment to better understand the health status of the community or of the county. It allows us to identify inequities beyond just looking at health behaviors and outcomes. It includes looking at social determinants of health and other systemic factors, kind of looking at more of the root causes of some of the health inequities that we're seeing. So again, the community health assessment takes into consideration health outcomes, other risk factors, social determinants of health, and again, that root cause, which is a big portion of the MAP 2.0 framework. It's just kind of making sure that we're taking a deeper look at the root causes of these inequities. And then lastly, the community context assessment is a qualitative assessment that allows for the collection of insight and expertise and perspectives for individuals and community partners. So this assessment will put the community status assessment into some kind of context. So it'll take the quantitative piece, which is that community status assessment, and put it into context with the qualitative data as well. So if you're considering, we'll start to consider people that live with, the perspective of people with lived experiences, things like structural racism, built environment, historical context. And some of the things that are mentioned here, the built environment is essentially an environment that people are living in. And then historical context, looking at different things in it within our historical, within the history of the community and the county, to see if there's any of those factors taken are affecting how the health outcomes of some of our residents in our community. So the results of the three assessments will be used to identify and kind of prioritize strategies to address the health status of the county. And that's just kind of a brief overview of the community assessments that will be used during the CHA, and it's a part of the MAP process, the MAP 2.0 process.
Thank you for that context, Deborah. And so, as you all remember, we gave an overview of the MAP 2.0 process that's going to inform the community health assessment back in our June quarterly meeting. And we brought you all here tonight to go over, as Deborah mentioned, this community status bubble that's going to talk more about the quantitative data. So we want to make sure that we're capturing data indicators that could get to the specific health priorities in Prince George's County. And then we'll also be able to inform the community context. So those questions that we're going to be asking in focus groups. So like Dr. Levy mentioned, when we ask you all to take part in these focus groups to know about your lived experiences. I know we have a lot of community members who are on the line with us today. And so getting your lived experience as a Prince Georgian and what can we do to make sure, what do we need to help prioritize to make sure that Prince Georgians can be their healthiest at every age and every stage. And so we'll get your feedback tonight. Again, we'll be focusing on this green bubble over here to the left to assess the community status, and then also moving into some of those qualitative pieces that we'll need to collect in order to prioritize health topics and our next health priorities in Prince George's County through the community health assessment. And so to help give context, I'm just going to quickly go over the Maryland Department of Health. They have issued their state health improvement plan. And so similar to what we do here in Prince George's County, the MDH, they just put out their state health improvement plan that outlines 5 leading health priorities from all of the jurisdictions across the state of Maryland. And they've given some additional context as to the areas that they're going to be focusing in each of these topics, these health topics, as well as some of the indicators that they are tracking to measure those health priorities. So their first health priority is chronic disease. They are focusing on enhancing primary prevention of chronic disease, as well as screenings, treatments, and care. And so to do that, the indicators that they are maintaining are the percentage of households experiencing food insecurity, adults reporting no physical activity, cancer screening tests, lung cancer screening, breast cancer, emergency room visits for asthma among children, diabetes, and hypertension. Their next state health priority is access to care. They want to enhance care delivery models and recruit a high quality workforce while reducing barriers to care. So to do so, they are tracking the proportion of statewide behavioral health outpatient service recipients who receive services via telehealth, the percentage of students enrolled in school-based health centers, the proportion of persons with a usual primary care provider, the average wait time for primary care first appointments, and the proportion of individuals not covered by private or public insurance. So again, these are the specific indicators that they're tracking for these leading health priority areas. What we're going to ask you all to do tonight is, when we're thinking about, we're going to show you all the health indicators that we were tracking for the past CHA. the community health assessment in 2022. And we're going to ask you all to give us some feedback. What data are we missing? What did we not track? What should we be paying attention to? So as we progress through this community health assessment, this version in 2025, we can make sure that we are collecting data that collect disparities, that we can see and we can track these indicators and make sure that our health priorities are aligned with the indicators that we are tracking. And the third state health indicator is women's health. The MDH is seeking to improve maternal health outcomes, increase breast and cervical cancer prevention and care. So they are tracking that through the rate of preterm births, infant mortality rate, low birth weight, unintended pregnancies with a focus on addressing health disparities, clinical screenings for postpartum depression and follow-up care, maternal mortality rate, prenatal care in the first trimester, breast cancer screening among women, adolescents 13 to 17 who are up to date on the HPV vaccine, and cervical cancer screenings. Their next leading health priority is violence. So the MDH is seeking to reduce firearm-related suicides, homicides, and injuries, as well as the harms associated with intimate partner violence. The indicators that they are using to track this priority are firearm-related suicides, firearm-related homicides, and emergency department visits related to intimate partner violence. The last health priority at the state level is behavioral health. The goals are to expand access to and the utilization of behavioral health services, reduce disparities in mental health outcomes, reduce overdose and negative health outcomes associated with substance use. To measure this health priority, they are tracking the following indicators, including emergency department visits for mental health conditions, rate of suicides, youth substance use disorder providers, utilization of public behavioral health services, students who felt sad or hopeless most days for more than 2 weeks in the past 2 weeks for all students and LGBTQIA+ students. If you're familiar with the WIRE-BS data, you'll notice that that question comes straight from that data source. The availability of affordable housing, the MDH has linked that to poor mental health. And so tracking how affordable housing impacts mental health, especially among students, LGBTQIA+ students. The last indicators are opioid fatality and emergency department visits related to addictions-related conditions. And so when we're about to go into an interactive activity that will ask you all to assess the indicators, the data indicators that we previously used in the 2022 community health assessment. But we also want you guys to keep in mind the state health priorities and to think about some of these areas and to see the indicators that we're already tracking. How does Prince George's County compare? Should we think about including some of these indicators, and what do we need to go further on? What do we need to pay more attention to, and what do we need to make sure that we're including in our data assessment as we progress through the community health assessment? So this isn't the last time you'll be seeing these. We have these again in the interactive activity, but I just wanted to give some baseline context that this is what the state of Maryland, what they are choosing to prioritize moving forward. And again, through their state health improvement plan, what they've laid out and the data that they will be tracking to assess the change that they make regarding these specific health priority areas. Any questions or any reactions to the state health improvement plan? And I see, Michelle, you have your question here. Are there still school-based health centers in Prince George's County Public Schools? Dr. Levy, I do believe we do.
Yes, I was just answering the chat. Prince George's County Public Schools has put out an RFP to partner on these. So they're there. They're just putting in an RFP for someone to run them. I don't know where they are in the process of this, but I'm due to follow up with the school, and I could probably give you an answer at the next coalition meeting or sooner. But the school-based health centers are no longer are not under the health department directly. They're under the school system now.
Thank you for that. Michelle, does that answer your question?
Yeah.
Okay, thank you so much. All right. Any other reactions to the state health improvement plan? All right. And I see a hand raise.
I just want to say that I think that the state has really assessed. I'll turn on my camera to be a bit more personable, but I do excuse the comfortable appearance right now post work in the evening. But my name is Wilkis. I'm working with MedStar Southern Maryland Hospital Center's Community Health Department, and I've been a Prince George's County resident for the last 10 years. So I've been through a lot of different ages and stages here in the county. And so it's wonderful to see that we are really tackling a lot of different issues that I've seen throughout my life growing up here, and that I'm facing now. And it'll be really interesting to see how the county incorporates this, especially with Dr. Levy, your perspective on turning the health department into a high I forgot the word that you use, high performance organization, because I think our community is just so unique. And I've talked about that with people who are not from Prince George's County. We have such amazing diversity across all kinds of different races and classes. And to see people talk about their lived experience. And for stakeholders with power to be willing to open up the door to allow community members in there, I think it'll be a really exciting time for our county.
Thank you for that, Bilquis. I really appreciate it. Yes, so this is something for us all to react to this evening. And again, like you said, so eloquently, to see where our health priorities align and where we need to tap into the different health priorities that we have here in Prince George's County, and to see how we have a plan that is best adapted to the diversity and all of the richness that we have here in Prince George's County. Any other questions? I see you're very impressed with the focus on mental health. Absolutely.
Yeah, I have a question. Is there a way that we could provide feedback for all of the indicators that you shared? I have a lot of thoughts about a lot of them, but I don't want to take up a ton of time in your meeting.
Yes, Michelle, we're actually about to enter into the interactive portion of the meeting, and we're going to go into all of the health indicators and see, and so you can offer some reflection then and see where some gaps are, if that works for you.
Yeah, that's fine.
Okay, thank you. All right, and then something else that I wanted to present that came out of the state health improvement plan. So the Maryland Department of Health, they asked, they sent out a survey. Many of you probably hopefully filled it out and saw that link as it went around the coalition. But the Maryland Department of Health was asking all of the jurisdictions to give out a survey that asked about the leading health priorities in each county. And so the Maryland Department of Health was able to reach over 350 Prince Georgians to get their responses regarding the most important issues affecting the health and well-being of your community, the most important things that make a community healthy, and then rating the overall health of the community. So Prince Georgians, this is how they responded, those that did respond to the survey. And so as we can see here, the leading issues affecting health and well-being, we have access to care as the leading priority. And then we have mental health. So going back to that comment there in the chat, mental health, the leading health priority, chronic diseases, homelessness, affordable housing, gun violence, jobs, economic development, education, nutrition, food access, climate change, and some more about environmental health. obesity, transportation, physical activity. So hopefully a lot of these sound familiar with some of the work that's being done in Prince George's County right now with our coalition and our work groups, and can inform some of our future work.
Taylor, can you hear me?
Yes, I can, Miss Cheryl. Can you hear us okay?
Just listen, I don't know what's going on with these links. They're acting a little crazy, but when we had an in-person meeting over on Kenilworth Avenue here in Prince George's County, we also had a discussion, and that discussion was very lively. They took down, they took specific and detailed notes, and we answered several questions. And I'm wondering if that exercise may have been folded into what we're looking at now. Do you possibly know?
Yes, so Miss Cheryl, we conducted the strengths, weaknesses, opportunities, and threats assessment, that SWOT analysis regarding our efforts in community engagement and partnerships. And so we're taking all of that feedback and we're implementing that as a coalition to implement with our partners and to engage them throughout the community health assessment. So what we're talking about specifically here has to do more so with the community health assessment and the data portion. But the coalition specifically is taking all of that feedback that you offered us in June to strengthen our engagement and our partnerships.
Okay. All right. Thank you.
Absolutely. Thank you so much for joining us, Ms. Cheryl. All right, and then the next question, what are the most important things that make a community healthy? So again, you'll see many of the social determinants of health listed here. So we have access to affordable health care, affordable housing, affordable food, safe neighborhoods, good jobs, mental health care, good schools and education, acceptance of all people, a clean environment, access to safe places to be active, affordable childcare, low disease rates, and religious or spiritual values. And then you can see from this pie chart here about the overall health of your community. We definitely have some work to work on. We have majority of responses here in the good and fair categories. But hopefully as we get through the community health assessment and we talk about the community health improvement plan and we're able to implement those strategies, with all of the partnerships that we have on this call and beyond, we're hoping that we can move more into this green category here, where folks in Prince George's County are reporting the health of the community as either excellent or very good. Any additional feedback or questions about this graphic here and the some of the priorities that were named in the state health improvement plan?
Yes, I have a question. Wait a minute, let me turn my camera on. Hello, it's BB again. So I'm a resident of Charles County. My question to you is, do we have one here for the health department in Charles County? And if so, where do I go to look at it?
Yes, so you should be able to, on the health department's website, they should have their community health assessment linked. But if you want to, we can exchange emails and I can help you locate that offline if that works for you.
Okay, I'll send it to you.
Okay, thank you very much.
In the chat. I'll put my email in the chat.
Okay, thank you. I will follow up with you. All right, and so as I mentioned, we are going to move into our interactive portion now. So we'll go through all of the indicators that we used for the 2022 community health assessment. And so as you can see here are all the topic areas that we focused on previously in the community health assessment, and bolded are the state health priorities. So I thought that this was a really important slide to include to show you all that so much of what we've already done is aligning with the state and what we continue to do. So again, those areas, we have access to healthcare, chronic diseases, sexually transmitted infections, adolescent health, prenatal and infant care, substance use and behavioral health, preventative screenings and vaccines, care for aging populations, accidental and unintentional injuries, physical activity, violence-based injuries, and environmental determinants. And we have, of course, our 4 coalition work groups that are also aligned with these indicators that came from the 2022 Community Health Assessment. So next, what we're going to do, we are going to dive deeper into all of those indicators that I just showed you, and we're going to start planning for the 2025 Community Health Assessment here in Prince George's County. So we want everyone on the call to start thinking through what topics, data sources, or matrices would be beneficial to include, and does your organization currently collect any data that would contribute telling the community's story? So to gather all of this information from you, we are going to ask you again to join this Slido. So it's going to be that same one that you previously joined. If you want to scan the QR code, you can join via the QR code, or you can go to slido.com and add this 7-digit code, which is 6101417.
Okay, I guess we'll start with the first question shown on your screen here. Is everyone already connected to the Slido, to the poll? Okay, great. If you're having any issues, please just mention it in the chat and someone will try to give you some assistance. What other indicators and data sources could be included to better assess access to care? So similar to what Taylor's already mentioned, here you'll see a picture of the data matrix that you also received via email. So you'll see a picture of this data matrix. If you're unable to see it, you can also use the attachment from your email that was sent with the agenda earlier. So if you could please just and within that document, within the poll, just add any other data sources that you can think of that we maybe need to include or think about that aren't listed there.
And so again, this topic is going to be under that access to healthcare umbrella. And so here you'll see the data table. These are all of the indicators that we previously used for the 2022 Community Health Assessment that we previously tracked. So for this, we have residents with health insurance, adults who had a routine checkup in the last year, residents with a usual primary care provider, and then resident to provider ratios. And then this list at the bottom here are the state health improvement plan indicators. So that's what I just went over with their 5 leading health priority areas. Here are the specific indicators. So between the two, what are we missing? What do we need to enhance? And what would you suggest if your organization is tracking any data for access to care measures? I'm seeing some responses coming in. So we have housing, access to healthcare providers in disadvantaged communities. The last assessment showed that residents do not use healthcare in the county if they have a choice. Can we assess where people go for healthcare and or what type they use?
And a lot of these are really great suggestions and also align with some of the things that we have been thinking as well. So that's great to see. It's always a challenge because of our neighboring counties, Montgomery and DC, and also Howard and Anne Arundel. We have a number of our residents that may go to other counties to seek services. And so we do have some opportunities to get some of that data, but there are sometimes issues with data sharing and things like that. But these are really great things that you guys are coming up with.
Problems paying copays. So that gets into, we focus a lot in the health assessment on the uninsured populations, but we don't focus as much on the underinsured. So I think that point gets to some of those populations. We have well visit within the last year, public behavioral health system data, claims from the ASO. I'd like to see where do people find health information that impacts their healthcare decisions. Residents with knowledge of how to apply for Medicaid care. Would anyone who submitted a response, would you like to give any additional context or any additional feedback, or for those who have not responded, any ideas you have?
I think a big thing that I see as a CHA, when we receive client referrals from the hospital, is that a lot of people do not know if they qualify for Medicaid or how to apply, or they're not familiar with Maryland Health Connections. They're not familiar with like transportation resources. I know that the county does like senior transportation and they can set up regular transportation to dialysis centers. And so things like that are just like they're available, but people aren't utilizing them because they don't know. But also when they do know, trying to figure out how to get people to utilize and trust. I think trust is a big part of it too. To get people to trust maybe even like a government entity or healthcare entities in general, for them to utilize those services. And so maybe stigma and trust building is an indicator for access to care as well.
And just to kind of circle back to the, kind of the MAP 2.0 framework, that's essentially what we're hoping to collect when we look at that community context assessment. There are a lot of systemic factors that, kind of impact health outcomes and behaviors, and getting to the root of those issues will be, I think, a long way towards moving health equity forward. So thanks for that.
I would like to see a lot of or more behavior health, mental health in the schools. I'm big on that. It's just a lot of mental health, a lot of things going on with the youth. I just think we need to focus a lot on mental health in the schools more with more behavior health coaches. That's my opinion.
Thank you for that. And please feel free to join our behavioral health advisory group. We're doing some great work in trying to improve adolescent mental health outcomes. So your voice would definitely be very helpful in that work group and advancing that work.
Taylor?
Thank
Yes,
you.
Cheryl.
Unfortunately, I've had to use my tablet and I can't access what we're doing at the moment. So I'm going to ask you via email if you can find a way to send it, and I'll do it on my tabletop. But here's something that I know is a thorn in the side, at least of me, and I would imagine it has to be in the case of some other, I'm going to call them consumers. I hate the fact that you can't identify or find information on the cost of procedures. I have Kaiser Permanente, and it knocked me to the floor when I had to go for a rotator cuff that required x-rays to find that not only is there a cost for the x-rays, but what that cost was. People are hesitant, at least I am, because as you have a condition or an issue attended to, with all of what is done in the way of prescribing medication or providing services, all you can do is sit there and see the dollar signs increasing. I don't know, but for me, that's a big issue, which is why I'm doing my best to stay away from them. I don't know if anyone else feels like that. Uh-oh, did I get cut off or something? Yeah.
Oh, no, Miss Cheryl, we can hear you. I was just typing that up to add it to our responses here.
Yeah, the cost for services. I believe the biggest get over is the fact that in the medical profession, costs for services are something that you can't examine, or you can't research prior to you having the services rendered to you. And I think that's a travesty. There should be something that gives you an idea of what it's going to do to your pocketbook before these services are provided.
I know
Absolutely.
there have been attempts at the federal level to try to support
That'd be
that and
something.
enhance it. I think it might be hard for the county to do that formally, but I think it's a really, I agree with you. You don't want to get hit with a bill that you didn't anticipate and make a decision based on what you're going to be able to afford. I think the whole thing is not right to begin with, but that's a whole other conversation, I think.
And talking about trust, that's another issue, another reason there's so much mistrust.
Absolutely. Well, thank you everyone for adding your thoughts here. A lot of sentiments to the barriers to accessing care, and certainly indicators that we will look out for and see what we can capture in the next assessment. So next
Hey,
we're going
Tim,
to move.
I have a question that we haven't, it appears that we haven't addressed on these issues, and that is uh, legislation and policies that affect the outcome of these issues that we're addressing. And so, some way we could align those policies in Annapolis to these issues that we're trying to address in the community. And that's what's missing here. So we haven't described the umbrella, nor has the state done it in this case. And if we look at it, the term is the political determinants of health. And all the things that we're describing here, what are the drivers? And so if we can align this with some policy or approved legislation or some type of bill that either influences it or take away from it. That's what we need. That's what's missing. So then we can put our policy guys, our councils, and public policy guys to work to either fix the problem or rectify it with some other amendment to those bills.
Thank you for that, Mr. Taylor. Yes, and that will be something that as we move forward, when we create these priorities and then we talk about what we're going to do to work towards the priorities in our community health improvement plan, that's where we can get into more of our policy change and the advocacy, and our work groups, especially within the coalition, will be able to look at those evidence-based practices and to see some of those policies and interventions that could address them. So thank you for that.
But who do we have looking at that now? Because, what you're saying is you're putting the cart before the horse. And so someone should be addressing these policies and legislations that are being discussed now and seeing what's the impact it will have on community health. Not wait until we go through this health risk assessment and stuff like that and got a product that we marry up with the state, and then we overlook all the policies that are coming down the pipe or existing policies.
Mr. Taylor, I think one of the things that we are trying to do is to better, I think in terms of the state health priorities, those are the priorities that the state has outlined based on the data that they've collected from the state. What we're hoping to do with this exercise and other things that we're doing at the county level is to understand what our priorities here are at the county level, and to use those priorities to better understand how we can impact policy from that standpoint, and start to make more evidence-based decisions. And so that's what we're trying to do in terms of, asking our community partners and hospital partners what things that we need to start to look at to better understand what's happening here in the county specifically. And so then that will help us to address those policy issues and those then to better impact and to better develop policy that would impact the health outcomes and behaviors that we're interested in seeing here in the county.
I think
Will we
Stephanie
be
had her hand up.
I'm sorry.
So
Will
I
we be
think
Sorry.
also that can you hear
Go
me?
ahead, Stephanie. Yep.
Yeah, so I think that so that's going to be a little bit a part of my role as well. Is being a part of the coalition, as it states right now until we change the name. One of the things I do want to bring in, and what I'm hearing is that we can bring kind of a policy overlay upon what we're doing. What is kind of the trend? What are the state looking at, even at the federal level, and then how can we influence or affect change at our local level and bring that forth. And your participation in the coalition as a whole participation can aid us in that work. So it's definitely not something that we will do in isolation, but something that we can bring to bear and really make it a part of the work that we're doing while we're moving these initiatives forward. What are the policies that we can either support or even put forth to kind of to advance the work we're trying to do. So I think that that's a part of my new role. But Dr. Levy, if I'm off basis, you can pull me back.
Will any of this be shared, or is any of this relevant with respect to our county council?
But that's the hope to
That was a
influence the
very,
county council.
so the answer is yes. We actually just today we just had our board of health meeting, and we got them up to speed with sort of where we are as a health department, how we're starting our strategic planning, and the CHA and the CHIPS. So we keep them informed through the board of health, but
Okay.
also we also are looking at how we get their feedback as well. And then I think one of the issues here, I know we're off topic a little bit, but as far as what we're trying to do today, but just to put a bow on it, there's several kind of policies. There's policies that support growth and health, and there's policies that pull that are detractors from health. And then there's policies that may not do. It may not be a policy for the thing we're trying to do. And I think as we go forward, we will be assessing alongside what we want to do, whether we need to change policy, change the legislation to do what we want to do or not, because there is something already there. There's something that is against what we want to do, or there's nothing there. And I think that's going to be a big piece of what we try to do as well, um, as a coalition and also as a health department. And Stephanie's going to be a big part of that also. Maybe we should circle back to what this, and then we can always have that conversation, broader conversation at either next coalition meeting, or we can talk offline.
Thank you, Dr. Levy. And so everyone's screen should advance to this next question. This is going to be about assessing chronic disease. And so again, the same situation, we have our matrices here that we previously collected in the 2022 CHA, but then also the state health improvement indicators. So our question to you all, what are we missing? What are your organizations currently collecting to better assess chronic disease? So we have a response here that says knowledge of food, nutrition on chronic disease, health education around prevention. So some of those prevention programs in the county, some of those county resources. We have cholesterol. Okay, MedStar Southern Community Health Department. Number of medicines taken. Break out the race ethnicity further to get a better impact. Deeper layers of race ethnicity. Pre-diabetes. Grocery stores, fresh produce and fruits. That reminds me of our healthy food priority areas map. That initiative from our Healthy Eating Active Living work group. All right. Any other reactions anyone wants to share regarding chronic disease? Great. So next, I know this one has been named a few times, but to assess substance use and behavioral health. And so again, we have in our 2022 community health assessment, we previously measured emergency department visits for alcohol and substance related conditions, age-adjusted drug-related death rate, age-adjusted hospital and patient visits due to alcohol use, adult binge drinking, adults who currently smoke, adult smokers, drug and alcohol intoxication, and age-adjusted suicide rate by year. I know, BB, this was a point where you brought in some adolescent mental health and assessing those measures, maybe partnering with the school. We have access to the YRBS data source that gives us data for middle school and high school students, and they have a few mental health questions.
I also wanted to add with the last question, and maybe with this one as well, for pregnant mothers, better screening, see if you can catch it in time at an early stage with the drugs, the substance abuse and the mental health, so they can be monitored more. I think that's very important.
And then we also have, can we include 911 calls for these behavioral health needs? And we also have 988, poverty and socioeconomic status, domestic abuse.
Are we saying also substance drug testing, or is this some other testing? Are we talking about assessment, behavioral health assessment?
So these would be any indicators, any data that we could collect. So if there are data sources, Ms. Cheryl, that you utilize to be able to talk about the behavioral health crisis in Prince George's County, or any of the substance use questions that your organization may ask?
The Black Mental Health Alliance, unfortunately, we do not provide direct services rather we maintain a database. So that wouldn't apply to us, but I was just thinking, I thought I heard you mention testing of some sort, and I was wondering if that included drug testing as well.
Infants in Prince George's born with drugs in their bodies. Gaps in behavioral health providers. So again, something that goes further than our mental health providers to resident ratio. Interesting. Affordable mental health care. So again, linking behavioral health and access to care. Peer recovery specialist or programs. All right. And are there any other reactions that anyone would like to unmute and discuss about substance use and behavioral health?
My phone is dying. That's why I can't text. I think we should try to build more mental health facilities.
One thing that I think I'm very passionate about mental health, especially within kind of like my age group specifically in the Gen Z and the younger youth population. I think that given the county's demographics, it is really important for that care to be tailored towards the demographics and the culture of individuals and their communities. And so for our Black community, we really value kinship. And so having a lot of our people receive care in kind of isolated vacuums of a therapist's office or a psychiatrist's office may not be delving into the issue the way that we want it to be. And so expanding our idea of what mental health interventions look like and tailoring that to the groups that we are trying to see more improvement in is very important, I think, in improving the health of our community.
Thank you for that. And throughout all of these indicators, like you said, that cultural humility and culturally competent care is something that we can have across all of our indicators and track track the physicians that are providing care to reach Prince George's County residents. So thank you for that. It's something that we'll think about for all of our health priorities. We have vaping and marketing of cannabis products. Right. I'm going to move on. Deborah, this may be our last one for the evening.
Okay. What other indicators and data sources could be included to better assess prenatal and infant care? If you all have things that you noticed from the metrics that we previously used in the 2022 trial, and then things that you kind of see within the state health improvement plan indicators that they've utilized. And if there's anything that you think that are missing, I'm sure that there are things that we've kind of talked about and discussed at the health department that you already mentioned. But also include anything that you think may be missing from this list of indicators in terms of prenatal and infant care, and also you can include maternal and child care as well.
So far we have sex education, access to family planning, number of births outside the county, transportation, grocery stores, access to care. So again, all of those overlapping and confounding indicators on health, more birth control. And I think when we previously met with some partners, with some hospital partners, when Deborah and I did, we heard from the hospital partners about maternal mortality. In the 2022 community health assessment, we focused a lot on infant mortality, but not so much of maternal mortality. Obesity and diabetes rates of pregnant women. Baby box initiatives. More education in schools, starting in 4th grade, quality of reproductive health care.
I'd like to add one of what other indicators and data sources. Churches are doing a lot to provide resources, particularly to women who are expecting, not necessarily prenatal and infant care services, but certainly those other services where you can receive diapers and assistance with those kinds of needs. I'm wondering if we should also be asking churches, are they collecting information on these women in particular and families that they're servicing to see if perhaps they're collecting something that might be useful to what we need to know?
Thank you for that, Ms. Cheryl. Yes, I know from a coalition standpoint, that's a partnership with our local churches that we've had to develop. Levels of breastfeeding and available services. Some schools have programs for pregnant teens. Thank you all for your interaction. I'm just going to flip through. We had a few more topics that we're not going to get to tonight, but we are going to bring back into our work groups and to ask some of our additional partners to give some feedback on. So something to think about moving forward. So we have indicators for violence-based injuries. We have preventative screenings and vaccines. Have better caring for aging populations, better caring and assessing adolescent health, better assessing environmental determinants, and better assessing sexually transmitted infections. And then we also have accidental and unintentional injuries. So all of these topics we'll bring back up into our work groups, and we'll talk some more about data indicators. But thank you all very much for all of your involvement tonight. And does anyone have any lingering thoughts? I know I just went through those remaining topics pretty quick, but does anyone have any thoughts to close out this interactive exercise?
There was a lot of conversation that was happening that I would really be interested in continuing offline with both the health department and with members who have spoken out. Is there kind of like a way or like an email chain where information is accessible, or could I put my email in the chat for individuals to contact me? What would be the best way, Taylor, for that?
Absolutely. Yes. If you can put your email in the chat, and I can reach out about getting you involved in the coalition. And then also we have 4 work groups that I would love to introduce to you and see if you have time to be a part of.
Taylor, I know you're going to wrap it up, but I just wanted to thank you and Deborah for putting these slides together. And I know this is a lot of work, and figuring out the way to get people to be able to put information in and make it as interactive as possible. So thank you for all your work on this.
Absolutely. Thank you, Dr. Levy. And thank you, everyone, for taking time out of your evening, for skipping dinner to be with us. I hope you all have had the opportunity to sneak in a snack and eat afterwards. But we would love to keep this conversation going with you all. If you're not a part yet of our work groups, here's our monthly meeting. So our 3 work groups here, the Health Equity, Behavioral Health, and Community Care Coordination Team, those folks meet monthly. And then our Healthy Eating, Active Living work group, they meet bi-monthly. If you would like to get involved in any of these work groups, please do so. We'll be continuing these discussions and we would love to have your perspectives heard. And so Ray will put our information in the chat if you would like to reach out to our email to get involved in the work groups. And then just in closing, you all have noticed me a little bit more this meeting, and that is because Kim Stinchcombe, she has left the health department. She previously managed the Healthcare Coalition. And so I just wanted to do a public announcement announcing the transition, and then also just thanking Kim for all of her hard work. She's not on the call tonight, but if you have been a part of the coalition, you know how hard Kim has worked to advance health equity and to advance all of the initiatives that have taken place across all the work groups. And so we thank her for all of her hard work and advocacy and wish her all the best. And Bibi, I see your hand is raised.
It's a mistake. I'm playing with the computer. I'm sorry. I'm trying
No.
to actually clock out. I'm sorry. I didn't mean to do that.
Alrighty. Well, thank you again very much for joining us this evening. If anyone needs anything, I will reach out to folks, and I'll be leading in the interim here. So if anyone needs anything or wants to get connected to the work groups, please do not hesitate to reach out. And otherwise, I will see you all back in person on December 10th. Dr. Levy and Dr. Little, do you guys have any closing remarks?
This is an excellent meeting, Taylor.
I really don't. I just wanted to say thank you, everyone, for your participation, your feedback, your input. It's so helpful, and it really helps to frame how we move forward, and we can't do it without your participation. So thank you so much again.
Excellent meeting, Taylor.
What she said.
Thank you. And thank you, Miss Cheryl. I hear you in the background. I appreciate you being here tonight.
You're incredible.
Thank you, Miss Cheryl. Thank you all so very much for all of your participation today and everything you do for the coalition. If anyone has any community announcements, I know we didn't get to that, but if you have any, put them in the chat here or reach out to me on email and I will get those featured in our newsletter. And I will get those shared with our work groups as well. But thank you again, everyone, for joining us.
Thank you. Have a good night, everyone.
Good night.